इसी में से पहली बार तो काम करो क्या हुआ क्या
So can you hear me?
तो ये लोग तो वैसे एबीडीएम का नाम भी
आईएमई ना
Are you able to?
बोला है क्या मुझे?
मुझे बोला था
तुम जाओ। तो मैं मैम के रूम में हूँ। हमने बोला श्री सभी इधर ही आ रहे हैं, वो ज्वाइन कर रहे हैं फाइनेंस का वेबिनार। हाँ total number of doctors 3176 registered.
कितना टोटल?
लेंगे तुम लोग भी वीडियो ऑन कर। या एंड रंजन
बना दी मेरे पास आ गया सर कलेक्शन का बना अब तक से और कुछ नहीं म्यूट ही रखा हूँ डेट वाला ही पेज रखिएगा बोला देखें क्या तुम बनाए वो हम दे रहे हैं बस माइनर करेक्शन सर सर से जो अडॉप्शन पे पूछा जाएगा वही ये ना कौन कर दिया कैमरा ऑन कर दिया
रंजन सर, सर आप हैं सर?
इसमें आवाज क्यों नहीं आ
कह रहे हैं कि शायद हैं।
रही को बोलिए ना बोलिए
सर आप ज्वाइन कर रहे हैं सर?
बढ़िया
गुड इवनिंग सर। स्क्रीन शेयरिंग बंद कर दें सर। We are good morning all the participants. We are here to have a webinar on the post-budget announcements that have been made in relation to the Ayushman Bharat Digital Mission. Sir, today we have planned this webinar and a small discussion around the announcements of Ayushman Bharat Digital Mission. We have been joined by Kiran Gopal Gupta, sir. He's the Joint Secretary and Mission Director of Ayushman Bharat Digital Mission. In addition to this, we also have Shri Ranjan Kumar, sir, Secretary Health, Government of Bihar. And we also have Shri Shashank, Shekhar Sinha, who is State Mission Director Government of Bihar of Ayushman Bharat Digital Mission. In addition, we have the Director of AIIMS Nagpur, two persons from the private sector, Mr. Amit Choudhary, who is the CEO and founder of Dawaadost. It's a pharma software company which has recently integrated with ABDM and has generated more than 1.8 lakh records. And we have Miss Upasana Arora, who is the CEO of Yashoda Hospital. The Yashoda Hospital is shortly going to onboard with an ABDM enabled system with us. So welcome all of you, and we have participants from various states, various health tech companies, as well as various persons from the public are also have also joined this post-budget webinar. To begin with, I would request Kiran Gopal sir to give his opening remarks. Over to
Thank you.
sir.
Thank you, Vikram, and thank you all for joining this post-budget webinar. I think one of the important things that we see in the current financial year about the Ayushman Bharat Digital that after having built the registries, after having built the gateways, and having run it thoroughly, truly from a tech point of view, uh, except minor improvements here and there, I think the tech platform has proven to be robust enough. We have been running our scan and share initiative that actually hits the systems at the peak of the OPD hours. We have our record sharing. The claims exchange has been made live, and there are claims going through. The record sharing is continuously happening. So from the tech side, the systems are ready, but now, like we said, after laying the roads, it is actually for the vehicles to run. And I think this post-budget webinar and the emphasis that has been given to digital public infrastructure and development of in digital infrastructure in different sectors of the government during the budget is something that we take a great take it with great pride that we are that unique group. And I mean, as a matter of fact, ABDM has been one entity where I think we would slowly be moving from a focus from tech to adoption in a large in a major way. And the current allocations and the current budgetary allocation that we have been utilizing them for various means, especially focusing on adoption through the DHIS and also through the microsites and also 100 model facilities initiatives. This in this webinar, we would like to also hear from our partners from the states, from the private sector, and experts who can actually give their opinion and guidance on how you think we can take this even forward and reach that critical mass where ABDM can take off in a large way, and the technology adoption curve, we actually come to that what you call the exponential growth phase of the adoption curve. So with this, I request to kindly let us take us through a very brief presentation so that we give you a content. And, we would then like to hear our participants and take the discussion forward. Thank you, Vikram.
Yeah. Thank you, sir. We have Ranjan sir also joining us. Good evening, sir. We'll do a small 10-minute presentation and then we'll discuss and listen to all of you. So the first slide that we want to show to you is is slide number 4. So budget that has been announced in the recent budget, wherein the budget allocation for the Ayushman Bharat Digital Mission has been laid out to rupees 200 crore. Ayushman Bharat Digital Mission, as you all know, is a central sector scheme. It was launched in 2021 with a budget outlay of 1600 crores, and there are various heads under which the budget under this scheme would be spent. It would be spent at the level as well as it would be spent at the state level. At the central level, it would be spent on digital information systems plus creating software. For example, the HIECM, the UHI, the NHCX, all the technological infrastructure that is created. It is all software systems. Then we have management salaries. We have consultants as well as officers here at the center for towards those salaries. Then a sizable amount is towards the IEC and capacity building, towards the publicity, towards creating awareness about ABDM and digital health. And this IEC and capacity building is important, and hence there is a provision in the budget to be used both at the center as well as the state levels. And at the state levels, we have the provision of supporting resources at the state level. At the state level, the mission would be headed, there would be a small office which has been provisioned, and it would be headed by the state mission director. To support the state mission director, a state PMU is most of the states have got a full-fledged PMU as of now. And also, as I mentioned, the IEC and capacity building, which is very important when it comes to digital health, being a great, it is a big change management initiative. Next slide, please. In the 3 years of implementation of Ayushman Bharat Digital Mission, we have come across various challenges in adoption of this mission. And as Kiran sir was mentioning, is that the only thing that we have to focus on is creating is adoption. How do we have more players? How do we have more vehicles on the roads? So of course there are the problems of challenges of awareness of ABDM. for which we have funds under IEC and capacity building. In the government sector, since digitization uh, is uh, is nascent both in the government and the private sector, there are challenges of adoption. How do we change management, and this culture of sharing information also needs to be developed in the private sector. Notably, there are it's a fragmented ecosystem, lot of different software, and there are these concerns of data protection, data privacy we see and hear, in spite of the fact that the digital personal data protection bill has been passed. So with the budget outlay and with the various initiatives that we are listing down, many states and many of you who have joined already know about it. But with these initiatives, we are planning to overcome these challenges. Next slide, please. So there are various ABDM initiatives which we have launched, and I will just quickly go through these slides because most of you might already be aware. The scan and share OPD, which provides quick OPD registration to various persons who want to go for OPD registrations at various hospitals. Around 602 districts are using this facility. Then we have the next slide, please. And we have the National Health Claims Exchange. I just want to mention here that there is a trinity of registries and trinity of gateways that the ABDM has built. The three gateways, NHCX is one of them. The HIECM, the Health Information Exchange Consent Manager, and the Unified Health Interface are the other gateways. But this gateway essentially is um, how do we provide a standardized flow of automated flow of health claims and insurance claims. So NHCX, we have launched it around all the insurance companies are onboarded here. Around 300 hospitals have been onboarded, and we see a lot of interest among all the hospitals of both the public and the private sector on this initiative. Next, please. As I mentioned, the unified health interface, which is for the healthcare services, providing interoperability among the healthcare services. We have launched it. Around 1,600 transactions have happened, and shortly we are launching it for physical consultation, blood bank discovery, diagnostic services, ambulance recoveries. And in this also, like the ONDC, we see a lot of interest among the healthcare ecosystem on providing digital health services. Next slide. This is the most important initiative that we are along with the support of the states, wherein what digitization actually is, what is exactly the value proposition of digitization. We want to showcase both in the public and the private sector. And scan and share is the first aspect of digitization. And what our aim is to create model facilities where end-to-end digitization happens, and we are able to show actually that this is the value of digitization. So next time we don't have to give a presentation and tell that, oh, you because of this, you go to any of these model facility and you can see what is the value proposition of this digitization. So a lot of work is being done. We have various institutes of national importance. AIIMS Nagpur director sir has joined this call. We'll listen to him in a bit, but a lot of emphasis is made on this. And once we do that, we will get good feedback as to how do we do it on a large scale. So a lot of money and a lot of efforts are being spent on this initiative. Next slide, please. This 100 microsites initiative is for the private sector adoption. How do we accelerate private sector adoption? This initiative is an year old. It is worth 30 crore rupees, where support is being given to to field officers to go to the doctors and educate them about digitization, and it has come fairly well. Next slide, please. The clinical decision support system is another initiative that NHA has entered into with AIIMS Delhi, wherein we provide a free software to the doctor to give him support as to what to give better treatment to their patients. So a clinical decision support system will say, hey doctor, you can also prescribe this medicine, you can also prescribe this test, this is a contraindication, and we have made it available as a public good, and any ABDM enabled system can utilize this clinical decision support system. Next slide, please. The digital health incentive scheme, of course, it is to provide incentives to their facilities, both in the government as well as in the private sector, as well as to support these digital solution companies, these software companies which create this software which is being used. We have seen good intake of this scheme, and we are positive that this will help in motivating the various healthcare facilities towards digitization. Yeah. Next slide, please. So present strategy of NHA is our last slide, and then we will open it for discussion. And the present strategy is for our public sector adoption as well as private sector adoption. Public sector adoption, we are, as I mentioned, using the 100 model facility. We want to drive adoption both in the central as well as state government facilities in 4 months. And thereafter, we want to take up the private sector, where we want to promote similar digitization and similar interoperability in the private sector. Presently, microsize DHIS initiatives, we have to work with the states as well as the private sector and our health tech companies, and address their problems, concerns during this year. So that is it from our side. And sir, if you have any, otherwise we can request other panelists also to share their thoughts.
No, I think we will request the panelists to kindly share your thoughts. We can ask Ranjan sir to kindly share his experience and what he thinks are the priorities that we can take forward, and at the state level, at the cutting edge, what are the things that we can take up in this financial year so that the adoption picks up the way we are expecting it. Over to you, sir.
Let me start with the little bit the origin of this ABDM, which I spoke on Shukra ki Sham, Dr. Gina. This has started from the health policy 2017. After that, 2018 strikes, and then 2019 blueprint, and then launched after piloting in 6 Union territory all over the country. So whole purpose was how to uh, make people comfort in carrying their medical records across different healthcare providers. So it was uh, well developed 3 these gateways, including this claim exchange gateway and the other gateways. So it is we all know that it is very secure now. The data can be transferred from one place to another, and that is instant. So in time, not only health provider have access to not only individuals' health record in time, and also the aggregated data have the different pattern. We can find health trends also from there. So for the policy maker also, and for the patient also, for the health provider, all have different benefit. But here the basic challenge is which we are facing, that this ABDM is very complex, because we all know that that is very secure, but people are not aware of the security, the way the banking system, people now they have the complete trust in the banking system, so they are using UPI without even thinking of where my money will go, and immediately they share their OTP and other thing on mobile application. So here, the first challenge is about awareness among people that we have come up with world-class this secure and ensuring privacy of data. So this and the purpose of ABDM is not to know about the business of private healthcare provider, but this will facilitate them to make them known to others that like I was surfing, they know your doctors. So you have a few names now because it is just starting. You can see the name of doctors available in Lucknow. You can see the name of the facility available in Lucknow. So in coming times, this will be more authentic and more large database. So the challenge is first is awareness. So how to make that? So I have done a lot of interaction with people. I have spent 3-4 hours in Badaयूं, one of the household, and I started interacting with them ki how to create AVA ID and what is the use, and then we have spent in different workshop facilities. So the basic premise is that what is the immediate benefit of this AVDM? So even in the decision making, even in the other meetings also, ABDM comes last. PMJY dominate the discussion because immediately they see that 5 lakh that money is getting. So this Ayushman Bharat digital mission, immediately we need to think of how to showcase something which people start believing in this KVD is most essential, and in the future this is the only platform where you can even think of universal health coverage, quality health coverage. So we have to strengthen this telemedicine because the universal access, which is the main mandate of this ABDM, we always say that the people in the remotest place, they can have access of all the health facilities. So how to do that? The first thing is the telemedicine and teleconsultation. So we have to strengthen that. The second thing is the HMIS. This is very costly, and where microsite we are implementing, only few modules are being given free from the private sector as an incentive, so people can adopt their software. But only 1-2 modules, registration module, another module. But the most important models would be the outpatient model, because if person want to take appointment in some hospital from sitting at home, just scanning QR, so they can get the time and they reach before 20 minutes and they get appointment with the doctor. So the second challenge about HMI, the implementing all modules of the HMIs. Also, once you get into the digital form, any
You're on mute, sir. We can't hear you. You're on mute.
okay, now
Yes, we can hear you.
hello. Yeah. So what I was saying, ki health facility, from point of view of the health facility owner. So once he is into the digitizing things, health record and other, he would like to have the financial, HR and other management also in the digital form, so I to connect everything digitally, because if you invest in training and other things, so other modules how to immediately bring into pictures. So not only according to the guidelines ABDM we should implement, but other thing which matters for the running of the hospital, that should also be immediately should be integrated. So in UP, I am aggressively implementing this next gen at the PSC level, urban PSC level. So I had recently Zoom meeting with all the 1400 urban CSC PSC, and very good progress that 200 already onboarded. So this HMIS is definitely giving lot of a scope, and we are not paying anything. So next gen is giving free of cost, and it is sufficiently, it include many of the modules. So we have to think of, we have more than 40,000 facility if we look at the health and wellness center, because all are important. So how to like expand HMIS, universalize this basic infrastructure where you digitize and capture the data, and also how to improve the overall environment of capturing data from different like behavioral devices, health ATMs, the other facilities. They have different kind of software applications. Sandbox, we give a facility, but I think a lot of work need to be done on that also. That so that like like if you look at the other software which is available, like suppose you have to download Java and anything, so they just ask you which system you have. So that kind of adoption, that kind of sandboxing, we should think of. Otherwise, it's very complicated. Many software are not able to do ABDM compliant. So how to get into that key? Because every hospital, they are implementing in one form or another form some application or software. So once this is done, so immediately so many hospitals come on board. And unless and until the varieties are there, the horizontal and vertical expansion is there, immediate benefit of this, because interoperability of medical records is not happening. Our ID is there, you scan share, we are definitely benefiting from that. But carrying the health record still is not been able because all hospitals are not still not on board. So we are planning to implement that also in few things. I have asked the different health facility, the government health facility, to note down at least 10, 20 patients' records who are being referred, or there is a possibility of moving from one hospital to another. So can we ask those hospitals where they are referred to adopt this ABDM, and so as to interoperability of medical records is happening in reality. So I hope that will be a good starting point for us. And this DHIS, this scheme, this is a two a scheme I see that which is from the government side to motivate private sector to come on board, is DHIS and microsite. Microsite, we see a lot of success, because before microsite in UP, we had very few health facility registry from the private sector, very few health HPR from the private sector. Now it's a lot good numbers. So definitely it is a very success story, and more than 1 lakh record we have linked in Lucknow. So this is really success story, and this comes from the basic training. I was part of the first level of training of these interfacing and developing agencies, these employee, and they were well trained to how to talk to them. And also I asked all the CMOs to conduct meeting with IMA representative and other at the district level, so as to make it real. So it was well thought of and well implemented, this microsite. So one to one, face to face, lot of success stories. We are publishing many papers based on the success story. We are capturing those different experiences. So definitely this helped, because we could create a kind of environment of every DM is real, and this benefit not they have any kind of danger. Second thing is DHIS. DHIS, we claim that one facility can get incentive up to 4 crore. So this is still challenging, because despite that, from our effort, and NHA has helped us in issuing that guidelines when I requested, So that helped a lot, and a lot of now expenditures now is happening in reality. But still, overall, they are not able to that health facility, the CMS and all, not able to estimate what are the things required to get adopted to this ABDM more better way. So we need more clarity in DHIS, and I think these schemes should not be stopped. It should continue, and also with more flavor and more other component also, because this is very good. Because digitization is not one will not only help. Suppose I want to increase expenditure, UP want to increase expenditure from 36,000 crore to 72,000 crores. So I see only this digital machinery can help decision maker. The data-driven decision making only can help where we should spend, because the capacity of our government employee and the system it seems to be limited. But when we take help of digital instruments, I think many times the capacity increases. So from that point of view, DHIS, spending on DHIS it should not be seen as expenditure, but it should be seen as promoting for the larger interest of so many things. So I think these are the initial thought of me about ABDM.
Thank you, sir.
Thank you, sir. Sorry, Vikram. I thought I'll just point that you mentioned about PMJY dominating the discourse versus ABDM. As you know, Vikram, I think now should have completed 3 years with ABDM now, and I'll be completing 3 years. That is actually the time in which this has been launched and it has been going on. This has been our pain as well, being in NHA. But because I was looking at both schemes from the beginning, so I was at least like involved quite a bit, pretty much with PMJY also. But let me tell you, sir, that I would say the government actually is now seized of the matter, and had actually a very, very fruitful and a very elaborate discussion with the Honorable Union Minister for Health, where now we have specific directions from him, under which we are now trying to implement this at all our 29 AIIMS and institutes of national importance. And he himself has said that he would be reviewing it. I'm sure this is going to be one of the things that will come up in the upcoming Chintan Shivers that would be conducted sometime perhaps in January. He also said that once we are able to do this in our INIs and other 87 facilities that we have identified in our states, he would be chairing a session with the private sector hospitals, large chains, where we can actually show that yes, this works and we ourselves are using it and taking it forward. Plus the ministry, because programs under NHM, which contribute to all the work that is being done under the various interventions under for primary healthcare under, let's say, NCD or NICSHAY or BM dialysis program or RCH program, they are also now not only integrated, but also we are now going to working on using ABDM to actually provide single interface for the field workers so that their life becomes easier. And UP has done some job, and some other states like Karnataka, Andhra, Telangana, Gujarat, we are working with them to make this something that is ABDM and ABHA based so that it becomes easier. So in a way, I would just wanted to say that the time for ABDM has come, and this is the time I think when
this is great news. This is great news. Yeah.
Thank you. We can have our next speaker, please.
Yeah. Our next speaker would be SMD Bihar. Bihar has been our another forefront state in the implementation of Ayushman Bharat Digital Mission, and I would request the SMD to please share their experiences of having an HMIS and rolling it out across the state, and how it has helped the state in achieving better efficiency and value it has created. So over to you, Bihar.
Thank you, sir. First of all, I will thank you for nominated me as a speaker on this program. I would like to say that ABDM in Bihar was not on the was not on the top of the list of our team, but from the last 3 or 4 months we worked very intensively on this program. Bihar was far behind at national level under scan and share token generation, and approx 7.5 lakh number of token was generated, only 7.5 lakhs till April 2024, and Bihar was on the second rank nationally. Further, with what we acted, that is we adopted coordination and convergence with the National Health Mission Agency, that is in Bihar is State Health Society. So this was the main focus that we coordinated with the NHM people who are block health managers in the block and everywhere. And we reached from 7.5 lakh token to 94 lakhs in October 2024. So we understood that there is need of behavioral change for the staff of public facilities operating in the state. And then we have been able to change the mindset of patients coming in the public facility. DHIS scheme plays a crucial role in changing the mindset of facilities. We focused on, we trained them, we focused them about the incentives given to DHIS, that how they can improve their facilities. In April 24, 12.56 lakhs DHI incentive amount was eligible to the claim, which increased to 5.89 crores in September 2024. In the what our strategy was, first, it was the we adopted we focused this scheme from district hospitals to PHC level to 592 your primary health center at the block level. We worked on to increase the token generation count in Bihar and started a scan and share from district hospital to PHC level. Currently, we are generating more than 80% scan and share token against OPD from district hospital to PHC level. In September 2024, 23.3 lakh token count has been generated, which is 80% of the OPD in Bihar. So it is a huge success to us. And now, in the second phase, we started from the primary health level to health and wellness center at the panchayat levels. We have started, and as of now, we have done approximately 10 lakhs scan and share at health and wellness centers. Currently, under total 10,320 our health facilities are registered under DHIS. Now we are focusing on the quality improvement under ABDM by creation of ABHA ID, electronic health record for patients facilitation, with a vision to create digital health infrastructure in the state. In October month, we had against 19.61 lakh OPD cases, we have done a scan and share 16.77 lakhs. And electronic health record, it is around 18.31 lakhs. The digital health, and the most important part, I will still say that this is the DGIS, the Digital Health Incentive Amount, which played a significant role in motivating staff to boost scan and share adoption, as incentives earned can be used as a utility fund for facility department. We are working on self-sustainable development of the health facility. For this, we have done gap analysis based on priority list, which has been developed to use the incentive amount at the health facility. This year, in this year, we have received DHI incentive amount of 18 lakh 78,000 around from April to September 2024. But we have a claims of around 5.9 crores in this DHI.
Shashank ji, मेरा एक निवेदन है. See, one of the what you call transformative things that Bihar has done is that you've been able to onboard an HMIS that is ABDM enabled, and usko aap पीएचसी लेवल तक, सब हेल्थ सेंटर लेवल तक इसको इम्प्लीमेंट करने का काम कर रहे हैं। ये एक्सपीरियंस अगर आप शेयर करेंगे, बिकॉज देर आर मेनी स्टेट्स लिसनिंग टू इट, हाउ यू गॉट टू दैट डिसीजन, किस तरह आपने ये किया है, एंड व्हाट काइंड ऑफ चेंज मैनेजमेंट यू आर डूइंग। अभी भी कई राज्य ये कर रहे हैं कि वी आर ट्राइंग टू लेट्स से इंस्टॉल ई सुश्रुत हो या ई हॉस्पिटल हो या नेक्स्ट जेन हो, जो इवन अ प्राइवेट सोल्यूशन हो। बट आई थिंक व्हाट कैन एक्चुअली कम आउट मोर क्लियरली इज कि हाउ आर यू मैनेजिंग, बिकॉज अल्टीमेटली केवल सॉफ्टवेयर लेने से नहीं होगा। आप जिस तरह से डिजिटाइज कर रहे हैं, आवर टीम्स हैव कम एंड सीन, एंड in fact we are suggesting other states also to send their teams to Bihar to see this, and कई बार suddenly they are get surprised कि अरे वाह, Bihar is doing it. So I think if Bihar can do it, many states, any other state can very easily do it. So मैं ये चाहूंगा कि आप उस एक्सपीरियंस को शेयर करिएगा कि how did that decision, how we are implementing it, and how we are managing the change of how this whole digitization. I think that will be very very useful for us.
देखिए, मैंने पहले ही कहा कि ये जो स्कीम था एक्चुअली एबीडीएम, ये हम लोग का आयुष्मान भारत मैंने जो हम लोग का स्वास्थ्य सुरक्षा समिति से इम्प्लीमेंट हो रहा है। तो हम लोग पास ऐसा कोई इंफ्रास्ट्रक्चर नहीं था कि हम लोग ब्लॉक लेवल अति तक कॉन्स्टेंटली मॉनिटर करें। तो हम लोगों ने सबसे पहला जो मैंने बताया कि हम लोगों ने स्टेट हेल्थ सोसाइटी जो एनएचएम का यहाँ इम्प्लीमेंटिंग एजेंसी है उसके साथ कोऑर्डिनेशन किए, क्योंकि जो स्कैन एंड शेयर जो भी जो फैसिलिटीज है, चाहे वो हम लोग का डिस्ट्रिक्ट हॉस्पिटल हो या सब डिविजनल हॉस्पिटल हो या ब्लॉक हॉस्पिटल हो या हेल्थ एंड वेलनेस सेंटर, सभी के सभी में जो रियल जो हेल्थ जो ये काम करते हैं पेशेंट्स के रजिस्ट्रेशन का या टोकन शेयर जो भी है, वो एनएचएम के एम्प्लॉइज है, वो हम लोग के नहीं है, एनएचए के नहीं। तो हम लोगों ने ये डिपार्टमेंट में लेवल पर इसका मतलब जो रिव्यू कराया कि ताकि ये दोनों विंग्स जो है कोऑर्डिनेट करें और एक वे में काम करें। इसके लिए हम लोगों ने जो है सो एनएचएम के ब्लॉक हेल्थ मैनेजर्स का जो है स्टेट लेवल पर मीटिंग किया, इन विच आवर ऑनरेबल हेल्थ मिनिस्टर श्री मंगल पांडे वाज आल्सो प्रेजेंट, एसीएस वाज आल्सो प्रेजेंट, और उन लोगों को मोटिवेट किया गया कि आप कैसे इस स्कीम को इम्प्लीमेंट कर सकते हैं। ये बहुत इजी काम है। उन लोगों को समझाया गया कि काउंटर पर बस खड़े रहना है, खाली आपको इस तरह से करना है। उन लोगों को हम लोगों ने इंसेंटिव्स का भी जो डीएचआईएस का जो है उसको पूरा डिटेल में बताया, और इसका कांस्टेंट मॉनिटरिंग हुआ। मतलब हमारे साथ जो यहाँ ज्वाइंट डायरेक्टर जो एबीडीएम का काम देख रहे हैं राजेश जी, वो बाई चांस उन्होंने इसका जो है डेली मॉनिटरिंग किया विद द डिस्ट्रिक्ट पीपुल कि आप कैसे कर सकते हैं। और जब जब ये काम जब शुरू हुआ तो बहुत ही इजी लगने लगा। इसके चलते आज ये रिजल्ट है कि हम लोग 80% ऑफ द ओपीडीज को कवर कर रहे हैं। यही है लगभग सब सक्सेस स्टोरी। और दूसरा है कि हम लोगों ने एक गैप एनालिसिस कराया, जो हम लोग का जो फैसिलिटीज है हेल्थ फैसिलिटीज, कि आप लोग एक गैप एनालिसिस कर लीजिए कि आपके यहाँ क्या चाहिए। हम लोगों ने उनको ये बताया कि आपके पास जो इतनी राशि आप अगर अर्न कर रहे हैं तो बिना गवर्नमेंट सपोर्ट के इस इंसेंटिव से आप जो है अपने अपने यहाँ आप ट्रॉली ला सकते हैं, आप बाथरूम को इम्प्रूव कर सकते हैं, ड्रिंकिंग वाटर को इम्प्रूव कर सकते हैं, मैंने जो भी जो बेसिक फैसिलिटीज है उसको कैसे हम लोग इम्प्रूव कर सकते हैं। तो हम लोगों ने इसी लाइन पर जो है लोगों को मोटिवेट किया। और इसके अलावा एक और चीज था, वो जो अच्छे काम कर रहे थे हम लोगों ने उनको पूरे स्टेट में रैंकिंग करके ऑनरेबल मिनिस्टर से प्राइज दिलवाया। जो भी मैंने हर कैटेगरीज में, वो चाहे वो डिस्ट्रिक्ट हॉस्पिटल हो, सब डिविजनल हॉस्पिटल हो, पीएचसी हो, एसडब्ल्यूसी हो, तो उसमें उसका जो टॉप 3-4 परफॉर्मर्स को जो ऑनरेबल मिनिस्टर से एक पूरे स्टेट लेवल वर्कशॉप में इसके लिए हम लोग अभी तक 3 या 4 वर्कशॉप कर चुके हैं स्टेट लेवल का। तो इसका रिजल्ट आया, यही है हम लोग का सक्सेस स्टोरी।
थैंक यू सो मच। एंड आई थिंक आई ऑल्सो वांट टू हाईलाइट दैट बिहार एक्चुअली आपका यू हैव योर ओन स्कीम वेयर द स्टेट एक्चुअली हैज पुट इन द बजट, जिससे आपने ये जो HMIS एटसेट्रा यू हैव प्रोक्योर्ड, राइट?
Yeah, we have a मुख्यमंत्री डिजिटल स्कीम in Bhabya
That is
India.
very very important, and I think this is something that other states can also try to.
एक दूसरा इसका जो पार्ट है ये माइक्रो साइट्स वाला। इसमें जो है सो हम लोग अभी रेसिस्टेंस फेस कर रहे हैं HPR और HFR रजिस्ट्रेशन में। कई तरह का प्रॉब्लम्स आ रहा है, डॉक्टर्स को या हॉस्पिटल्स को कई तरह का मिसगिविंग्स है कि हम ये करेंगे तो ऐसे फंस सकते हैं, वैसे फंस सकते हैं। तो हम लोगों ने एक मीटिंग प्लान किया है बिहार के आईएमए प्रेसिडेंट, जो बाई चांस नेशनल प्रेसिडेंट भी थे प्रीवियसली, उनके साथ जो 3 डिस्ट्रिक्ट हम लोग का कवर कर रहा है माइक्रो साइट में, उन लोगों के साथ हम लोग मंडे को प्लान किए हैं। तो इसमें जो है सो थोड़ा सा ये रेसिस्टेंस आ रहा है डॉक्टर्स की ओर से।
जिसके चलते हम ये माइक्रोसेट वाला काम बहुत आगे नहीं बढ़ पाए। पटना में कुछ बेटर हुआ है। और एक और चीज था जो हम कहना चाहेंगे कि अभी तक अनफॉर्चुनेटली जो है हम लोग इतना अच्छा काम कर रहे हैं एबीडीएम में, लेकिन 24-25 में हम लोग कोई एलोकेशन नहीं मिला है, बजट एलोकेशन, जिसके चलते हम लोग अपने अभी स्टाफ का सैलरी दशहरा में फंड्स को डाइवर्ट करके करना पड़ा। वी हैव सेंट सो मेनी रिवाइज यूटिलाइजेशन सर्टिफिकेट्स, आई डोंट नो व्हाट इज द प्रॉब्लम, सो आई विल रिक्वेस्ट यू काइंडली रिलीज इट, ताकि हम लोग सैलरी वगैरह दे सकें। इसमें जो पीएमयू का जो सैलरी हम लोग यहाँ जो काम कर रहा है उसका पेंडिंग, आई डोंट नो व्हाट इज द
I
प्रॉब्लम।
think I'll also review at my end why the funds have not been released to you, and I assure you कि I will myself talk to you on this.
थैंक यू, थैंक यू।
Thanks. So now we can now have our next speaker, please. Who would it be?
Sir, I would now like to request the Director of AIIMS Nagpur, Dr. Prashant Joshi, to please share his thoughts. As I had mentioned to you, AIIMS is one of the institutes of national importance, and we are working with all the AIIMS and with the Ministry of Health and Family Welfare, the PMSSY division there, to work on end-to-end adoption in all the AIIMS. So I would request the director to please share his insights and share his thoughts as to how this initiative of digital transformation is going up. What is his experiences, and what are his thoughts on this? What more can
Good evening, sir.
sir?
Good evening, sir. Myself, Vijay Nayak, DDA AIIMS Nagpur. Our ED, Dr. Joshi, ED sir is there. Actually, last year when we started, we actually requested that AIIMS Nagpur to be taken as a pilot for implementation of scan and share and other thing. And it was really implemented at AIIMS Nagpur in letter and spirit. And really our queues have gone down, and self-registration kiosk we created and everything. So we were having very good internet connectivity and backup and everything. And now there is no patient queue. We are able to register the patient even at 4 p.m. and everything. And that is why our footfall has also increased. Despite that, we are able to manage the patients in our OPD, and perfectly it is running fine. Now we are continuously every week, we are working with NHA team also for taking it to level. With scan and pay, we are working on scan and pay and other things. And really, this has helped a lot for AIIMS Nagpur, ABDM mission. And we are really thankful for NHA team they came down, they have seen our OPD, IPD and functioning everything, and it has helped a lot.
PHRs, the number of PHRs are increasing exponentially as registrations are going up. So we are in the process of updating PHRs. Last time NHS team has visited, they have given the mass registration facility through their push throughs, and that currently the work is going on. So remaining PHR that have been HPR that has to be incorporated is in the process and shall be soon completed to achieve 100% saturation.
Health registry.
Thank you.
I think AIIMS Nagpur has been one of our leading aim in digitization effort, and I think your experience and your learning and of course your leadership is actually going to what you call inspire and also serve as an example for the rest of the institutions in and around Maharashtra and close by areas of Madhya Pradesh, because we actually look forward to our aims and institutes of national importance, like I mentioned, and the Honorable Minister is very keen on taking this forward. And we really thank you for your support. And we actually get very good feedback from our teams who go to Nagpur, and I believe you will also be starting scan and pay soon. I think once that starts, you will also see more in benefits coming in. My earnest request to you is to try to identify some of the departments where you can actually start creating EHR and using records. And I think that is where the real benefits will come in, and integration of the lab reports with the HMIS, and also how we can do it in the IPD. Because once, like I said, और इस तरह के बड़े इंस्टीट्यूशंस को देखता है कि हाँ वहाँ हो सकता है तो हाँ यहाँ भी हो सकता है. So I think your leadership in this regard would be very, very crucial. And like I said, in the remaining 6 months of this financial year, adoption is going to be the key. And what we do in this financial year will drive our efforts in what we set as a benchmark for not only government institutions, but also private institutions.
Thank you.
Yes.
Thank you.
Thank
Thank
you
you
so
for
much,
your
sir.
leadership. Thanks.
Thank you. We now move to the next speaker, Amit Choudhary ji. Amit is the founder and CEO. Dawaadost is a pharmaceutical software making company, and they have recently been onboarded on ABDM, and they have. I'm very pleased to say that they have created about 2 lakh interoperable health records. So I would request Amit to please share his experience with on ABDM, on his journey, and what he thinks is the value of ABDM, and any suggestions if he has.
Thank you so much,
Amit.
sir. It's quite an honor to have so many dignitaries on the call. We started roughly 100 days back on our journey with ABDM under Vikramji's guidance on how to go about it. We've done we run pharmacies also, our own pharmacies. So we were among the early pharmacy partners to the network. And we did 2 interventions to drive more adoption. One, sorry, you're asking something, sir? Sorry, I
No,
can't hear
I'm
you.
not. I'm not. I was just. Please.
Sorry. We hired dedicated people to educate people on ground when they interact with our pharmacy partners as well. So I think that is one step we took to drive more engagement and education to the end user, the patient. Secondly, sir, we also drove a lot of customer promotions to do the first time interaction with us. As an example, I had shared this with Vikramji. We gave out free medicines to some people during this process in terms of early adoption, kickstarting that whole work. And that's helped us come close to, I think, by tomorrow morning, noon tomorrow, we should cross 200,000 health records on our system. So I think we've been very fortunate to kind of get a lot of guidance on how to do this right in terms of different activity system, in terms of tech integration, etc. So we have 2 recommendations on what else can we do. And these are things that I've discussed and I'm kind of talking to Vikram sir also on this. One is to think through, sir, how to drive more engagement of the end patient with the entire system, which is not just about when do you need to do, when I need to activate a healthcare system. As a simple example, sir, we have a library of 8 million videos today which about medicines. And one of the things we've been wanting to do is integrate that library into the network so that anytime anyone, not just from Dawaadost perspective, but wants to tap into saying, I want to understand this, what is my prescription, how do I look at things, etc. They can do that. We'll be running, sir, a separate pilot on this with the Banaras Hindu University in UP to see how the patient interactions are, and we're getting very good feedback. And they're all in local languages, sir. So we have 8 different languages covered there. And the second one, I think, sir, you also referred is how do we drive adoption in terms of transactions? And that's, I think, as we
Go ahead. Go ahead.
sorry. Sorry, sir. The last piece I was saying was, if you allow us, we would love to do a pilot, sir, of the adoption of ABBA in terms of demand fulfillment in Rajasthan. We are headquartered here. And today in the city of Jaipur, everyone is 8 to 9 minutes away from one of our stores. So we can really, between yourself and us, deliver medicines on time to people as well. So those would be the 2 requests, sir, that we would have of you.
Thank you. Thank you so much, Amit ji. I think, the more engagement of the patient. Yes, one of the things that we're talking about is the use cases, but like you mentioned, they come into play when the person really falls sick and will have to go to a hospital. But I think the engagement part becomes very important to have these many videos that can be shown to them. I mean, maybe we can work with you and see how these videos, if they're available and can be, if they are indexed. And I'm just as a thought, if I'm saying that, let's say somebody is using a PHR app, and with the person's consent, we are able to understand from his records that the person is, let's say, diabetic. If we are able to direct some of the videos about how to take care of their sugar levels, etc., through these videos, tailor the videos in a way, I think that would be one way we can do it.
Absolutely.
So I think let's work on it separately,
Yes.
offline.
Yes.
And regarding your work in Jaipur, Rajasthan, I think the SMD of Rajasthan is there. He is also in this. I'm sure their team also would have heard this. Let's see how we can take that dialogue further as well.
No, we'll do that. Thank you so much, sir.
Thank you. Thank you.
I would like to now invite Upasana Madam. Upasana Ma'am is the CEO of Yashoda Hospitals, and we are very pleased to inform that Yashoda Hospital is also onboarding full-fledged on ABDM. Their software Akhil Systems has become ABDM enabled. They are using Akhil Systems since a long time, but now they'll have an ABDM enabled system. She has been a participant of the first post-budget webinar, which we had in 2021, a seasoned professional. So we would request her inputs, guidance, suggestions on this entire initiative. Over to you, ma'am.
Thank you so much for giving me this opportunity where I can, tell that now we are fully equipped with ABDM software from Akhil system side, as well as Yashoda has already got ABDM certification. And we are doing lots of Ayushman Bharat, treatment for kidney and all. My request is if we can, encourage more. I am playing my role whenever I am going anywhere in any kind of conference or any kind of meeting. I am telling everybody that you have to, other big hospitals, they have to adopt, only then this scheme. And because big hospitals are already having good softwares and they can do easily. So we need to just, encourage them, and everybody has to be on board. Only then we will be able to actually do this. We were not generating all ABHA numbers, but now we have started recording all the patients on ABHA so that we can get more numbers. And all doctors are already registered. Hospital is already registered. So I'm spreading this news, but as somebody said that they were just, got some certification, some award or something like this. So this kind of things, promote others also to come forward, and they will think that if they are doing this thing and they are getting some appreciation, we should also take part. So from my side, ABDM is going to be really game changer for Indian healthcare, because now I am on a different platform of different countries also. So I am very proudly saying that India has a biggest health scheme with the total digital thing. Like I want that ABDM should be like pay phone or UPI. So it's my wish, and I will work with all of you hand to hand, and best wishes to everyone who is working for this. Thank you.
Thank you so much, ma'am. And I think support of large hospital chains like yours is very, very important. And like I mentioned earlier, this was noted by the Honorable Minister also. And I think leaders like you will be playing a very, very, because the message you send across is going to echo far more, and and to a larger audience, and will also be more effective when we start engaging more with the larger hospitals. And I think that is actually what is going to come next for us also, and we would actually be coming to you and taking your support and talking to you, to other of your fellow hospital chains, because I think we want this ABDM to weave the entire hospital network of our country together. Not only public, not only small, very small hospitals, not only private, small single doctor clinics, because ultimately the tertiary care and the secondary care, high quality care is provided in the larger hospitals. And the kind of quality records that they provide actually are going to be the basis for the palliative care and also follow-up care that is generally taken at the primary level. So I think seamless exchange of information between these two levels of care is very, very important for the ultimate benefit of the patient. Moreover, you are already an adopter of technology, you are using it, and therefore using the data that otherwise is available with the patient or available only on paper. Now using the data digitally, you will also be able to provide better care to the patient that is coming to you, because you have the tools and the wherewithal to do the required analysis. So we really thank you very much for coming on board and setting an example. And I think with your support, we can even take this further, make further inroads into the private sector engagement and make this adoption truly inclusive. And the whole idea behind the ABDM or the objective of government while forming the mission was that government alone will not be able to do it. We will require support from the private sector, and we would require the buy-in from the private sector.
Sure.
And when we show the health stack, we always show on the top, we say this is what we alone cannot do. The applications, the user-facing applications, be it HMIS or PHR apps or payer provider applications. And I think the active role played by you is going to set an example for everyone, and we can take this mission forward. Really, thank you very much for your support, please, and also your guidance. Thanks.
With this, we come to an end of this webinar, and we thank all of you for your participation, particularly the panelists. In this, there was a query that whether the recording of this webinar would be available. Yes, we will make this recording available on our YouTube channel shortly, and hope we have a good year and we are able to go to a digitized India in this year in this sector of healthcare. Thank you again for participating. Thank you.
Thank you, everybody. Happy Diwali, everyone. Bye-bye.
Thank you. Thank you, and happy Diwali in advance to everybody.
Thank you.
Thanks.
Thank you.